Did you press go? Okay. Hi, my name's Kimberly. I'm going to be your nurse for today, okay?
Okay.
Can you tell me your name?
Brooklyn.
How old are you, Brooklyn?
13.
And I can tell you're a female. Can you tell me the reason for your visit?
I have itchy and red eyes.
Okay. Do you have any drainage with those eyes?
Yes.
What's it look like?
Yellow.
Okay. How long has it been going on?
A week.
Okay, good job. When you wake up, are they matted or anything?
Very.
Okay. So are they painful?
Not really painful.
Okay. Okay. Do you have any major medical history?
Like parents wise?
No, you.
Oh, me? No.
Okay. Allergies?
No.
Do you take any medications for anything?
No.
Have you had any major accidents like broken bones or anything?
No.
Have you had any surgeries?
Yes.
What surgery have you had?
This from my neck.
Okay. Okay. How old were you when you had that done?
9.
Okay. So do you take any drugs?
No.
Do you drink alcohol?
No.
Do you smoke any type of tobacco?
No.
Okay. Are you sexually active?
No.
When was the date of your last period?
Last week.
Okay. Are there any diseases in your family that maybe more than 1 or 2 people have had? Maybe like 3 or so?
Yes. High blood pressure.
Okay.
Asthma.
Okay.
And diabetes.
Okay. Good job. Okay, so I'm just going to look at you for a second, and as I can tell, your appearance is very well kept. As far as orientation, you told me your name. Do you know where you are?
My friend's house in Raymond.
Okay, and what's today's date?
August 8th,
Okay.
2013.
Behavior-wise, you're very cooperative. I can tell you're doing well on that. Nutrition-wise, do you feel like you have a good nutrition?
Yes.
Do you eat lots of fruits and vegetables?
Yes.
Do you drink a lot of caffeine?
When I'm tired.
Okay. Do you exercise?
Yes, I do.
Yes, you do. So posture-wise, you're sitting up very well. Your mood is appropriate. Your affect is good. And coordination, we're going to test in just a second. Okay. So I'm just going to also do a little review of systems. So first, I'm just going to start off with the head area. Have you been having any headaches or anything? Dizzy? Blacking out or anything? Ear-wise, do you feel like your ears are like muffled, like you're hearing? Any problems with your hearing? Any drainage on your ears? Okay. Your eyes. So you did say they're red. Drainage there. It's been going on about a week or so. Nose. Do you feel like you have a stopped up nose, runny nose? Throat. Sore throat or anything? Pain on swallowing? Okay. So as far as your heart, do you feel like you have any chest pain or anything? Do you feel like your heart is racing or any pounding in the chest? Okay. Lung-wise, do you feel like you have a hard time breathing or anything? I know you said you have asthma in your family. Okay. So belly-wise, do you feel like you go to the bathroom regularly?
Yep.
Okay. Any belly pain, tenderness? Do you, when you urinate, is there any pain, any discharge, anything like that? Any tingling in any of your fingers, your toes, vision disturbances? As far as your muscles, do you feel like any joint pain, tenderness in like your legs? And skin-wise, do you have any rashes or moles that you feel like are bothersome or anything like that? Okay, so what I'm first going to do is I'm going to wash my hands again. Wash. Okay, and so my Snellen chart fell down. And so what I'm going to do is I want you to stand over here for me. Over there. And what I am going to do is we are going to do a vision screening on you, okay?
Okay.
Do you wear glasses or anything?
No.
Okay. So what, you can't see this chart. You see it then? Yeah. So I am first going to, without any glasses or anything, or covering your eyes, I'm going to point to a chart, spot on the chart, and I just want you to tell me the letters, okay? Ready?
P, E, C, F, D,
Okay, good job. Can you cover your right eye?
E, D, F, C, V, P,
Okay.
D, E, F, P, O, T, E, C.
Okay. Can you cover your left eye? Take a few blinks. Okay. Oh, wait, we're going to go this way, actually.
U, E, T, O, E, F, E, D.
Okay. So you missed a few. That's fine. As long as you got more than 4 right, you're good on that. So vision-wise, you're 20/20. Okay. Can you go ahead and sit back down for me? And I'm going to move the... Okay. So it's still good. Okay. So first what I'm going to do, I'm just going to sit down for a second with you, okay? So what I'm going to do first is I am going to palpate your head. I might have to pull your hair out of your rubber band, but I'll let you pull it right back up, okay? Can you take your rubber band out of your hair? Okay. Healing more. So I'm just palpating your head, checking for any lesions, any bumps, checking for baldness. The texture is good. I don't feel any bumps or lesions. Distribution is very good. No baldness, no areas like that. Do you want to put your hair back up for me? Okay. So what I'm going to do also next is I'm going to palpate your lymph nodes. And I want you to tell me if they're tender. And I'm just going to check for swelling and things like that, okay? Yeah, you can see me. Okay, hurry up. Okay, that's good. Okay, so sit up straight for me. I'm just going to palpate. Come down. Okay. Can you swallow? Any tenderness in any of these areas?
No.
Okay. Can you open your jaw for me? Close. Any pain right here?
No.
Puff your cheeks in. Suck them in. Can you clench your teeth for me? Open your chin out. Stick your chin out. So, pull your chin in. Can you move it side to side? Frown. Smile. And can you put your eyebrows up? Okay. I'm just going to palpate right here, and I want you to tell me if there's any pain. Any pain?
No.
Any pain?
No.
Any pain here?
No.
Okay. So now what I'm going to do is I'm first going to check your ears. I've got a little light. I'm going to look inside your ear, and I just want to look, and I'm going to look for drainage and everything, okay? Pull it up. I'm just looking. Okay. So I'm not seeing any much drainage, just a little earwax on the inside. Your tympanic membrane is gray and pearly like it's supposed to be. It's not red, doesn't look like there's any fluid behind it, so that ear looks good. I'm just going to check the other ear. And same over here, no redness. Tympanic membrane is gray, like a pearly gray. It's not red or anything like that. So I am going to check your eyes. So what I want to do is I'm going to take this pen light. I'm going to make an H. I want you to follow the light with your eyes only. Do not move your head or anything like that, okay? Okay, so now what we're going to do is I'm going to check your peripheral vision, and I'm going to cover an eye, and you're going to cover the same eye. And I'm going to move my hand, but don't tell me when you see just the hand movement. I want you to see the wiggling fingers. And when you can see the wiggling fingers, I want you to tell me, okay? Okay. Can you cover your right eye? Okay. Cover your right eye. I mean your left eye. Okay. So now I'm going to take this. I'm just going to look up your nose. Can you tilt your head back for me? Okay. Tilt your head back. So I'm just going to look at the turbinates. Yeah. and I do not see any redness or drainage. Looks good. No deviated septum. So what I'm going to do now is I'm going to look at your optic disc, and I am just going to use this little light, and it's going to allow me to look at the back of your eye, okay? So just look straight ahead over my shoulder, okay? Probably would be easier. Okay, so blood vessels look good. Optic disc is yellow, which is normal. I'm gonna look at this side. Okay. Blood vessels look good. And I see the yellow optic disc, so there's no problems there. Okay. So now what I'm going to do is I'm going to look in your mouth. And I'm going to change my scope out. So I'm going to need you to just open up. I'm going to look under your tongue. I'm going to look just inside, and then I'm going to look at the tongue and make sure it looks okay, okay? Can you, big for me. Or actually, I'm going to use my pen like, no. Okay. Not seeing any lesions. I do see a little bit of one right here. It looks like you have braces, so that's typical. Okay. No missing teeth. Teeth are evenly spaced. Okay, go big, stick your tongue out. And the uvula looks good. No red, no white. And I'm going to have to gag you. Okay, ready? Okay, good job. So now what I'm going to do is I am going to take my tuning fork. I'm going to hit it, and I'm going to place it behind your ear. First, what I'm going to do, I'm going to do it on the top of your head and the forehead, and I want you to just tell me if it sounds even, okay? Ready? It's even? Okay. So now what I'm going to do is I'm going to hit it behind your ear. I want you to tell me when you can not hear it anymore, okay? And then I might move it and where you can hear it again, and you just tell me when it goes away, okay? Can you hear it? Can you hear it? Good job. You have to hear it. Wait for the whole time because you probably hear it for a while. Okay, let's do the other ear. Can you hear it? Can you hear it? Okay, good job. Okay, so what I'm going to do now is I am going to do what I call a whisper test. I'm just going to stand to each side, and I'm going to repeat some numbers, and you just tell me what they were, okay? Okay, ready? What? Good job. Oh, yeah, hold on. Okay, still filming. Okay, so now I'm going to do another number. Okay, good job. Okay, so now what I'm going to do is I'm just going to look at your skin. I'm just going to assess it. I'm going to look around for moles, and I'm going to check your skin temp and everything, okay? So can you stand up straight for me? So skin looks good. I don't see any signs of rashes, a little bruising right here. Temp is good. warm, no signs of moistness. Turgor is elastic, no signs of edema. Cap refill, I'm gonna look at your nails, they're pink. I can tell you have nail polish on them. No signs of clubbing. Cap refill is less than 3 seconds. And so I also, you said you had surgery, but that was in underneath your tongue, right? So I don't see what I can see for now. I don't see any signs of incisions also, okay? Okay. So what I'm going to do now is I'm just going to do a little chest assessment on you, okay? You sit up straight. So chest-wise, I don't see any signs of barrel chest, which is common in like older adults. Looks symmetrical, no deformities. Can you turn to your right for me? Your body. To your left, sorry. I'm just going to place my hands on your back, and I want you to take a deep breath, and I'm just going to check. I'm just going to check if it is symmetrical, okay? Can you take a deep breath? Okay, so it's symmetrical. So now what I'm going to do is I'm going to put my stethoscope, or I'm actually going to put the balls of my hand on your back, and I want you to say 99, and I'm just going to check and see if I can, if it's symmetrical, okay? You say 99?
99.
Okay, so it is symmetrical. What I'm going to do now is I'm going to take my stethoscope and I'm going to place it, and I just want you to say 99 all over, okay? Hold on, I got to change my. Go.
99.
Okay, so now what I'm going to do is I'm just going to listen to your chest, okay? Can you stand up, sit up straight for me? I'm just going to listen on the front for you. Just breathe normally. So I don't hear any crackles or wheezes. Wrong eye. Okay, I'm going to listen to your back. Oh, sorry. Deep breath. Tell me if you get lightheaded or anything. Okay, now I'm just going to take the other side of my stethoscope and listen to you, okay? Just going to go underneath your shirt, okay? Okay, so now I'm just going to use this side of the stethoscope also on the front. I didn't do. Okay, you sit up and I'm just going to place this underneath. Deep breath. And again, I hear no abnormal breath sounds. Okay, so now what I'm going to do is I'm going to do something called chest percussion. Sit this way, and I'm just going to listen to hear if I can hear any abnormal sounds, okay? Okay, I'm just going to go underneath your shirt. Okay, good. Don't hear any sounds of fluid or anything like that that you would typically hear on chest percussion, okay? So now what I'm going to do is I'm going to listen to your neck arteries. And I'm just, at times I might tell you to hold your breath. I might tell you to breathe normally, okay? Okay, sit up straight. Hold your breath for me. Okay, you can breathe normally. Now I'm just going to listen to the middle. Breathe normally for me, okay? Okay, palpate your carotid. It's about normal, 3+ pulse. Can you tilt your head back and let me just look? So I don't see any signs of jugular vein distension. So that's good, looks normal. And so what I'm going to do now is I'm going to listen to your chest or your heart rate, okay? Okay, can you open your eyes and look at me? Okay, so what I'm going to do now is I'm just going to listen to your heart, and there's different spots I'm going to have to listen to, and I'm going to have to listen to both sides of my stethoscope, okay? Okay, so first I'm just going to listen to it, just see if it's like a normal rate, kind of rhythm. So the rhythm's normal. So what I'm going to first do is I'm going to count down on your right side, 2 ribs, 1, 2, and this is your aortic. Actually, I'm going to do this side first. So your aortic. My stethoscope's acting. Okay, so the rate is good. No signs of murmurs. Go ahead and listen to it with the bell there. Sounds good. So 2 ribs down on the left side is your pulmonic area. And again, there's nothing. It sounds good. Regular rate. No signs of murmurs. Go listen to it with the other side of mine. Okay, so now I'm going to count down 4 spot ribs. 1, 2, 3, 4. And this is on your left side. It's going to be your tricuspid. I'll listen to it with my other side of my bell. And again, it's good. And now 5 spaces down. 1, 2, 3, 4, 5. Mid collarbone is your mitral. And it sounds good, and I'm going to listen to it on the other side of my stethoscope. Good. I didn't hear any signs of bradycardia or tachycardia, which is just like a slow heart rate or a fast heart rate. But what I'm going to do is I'm going to do an apical pulse. And this is just, I'm going to listen to it for 1 minute. Nice. So I'm going to count down 5 spaces, mid-clavicular line, and this is going to be your apical pulse, okay? It's going to be the best spot to listen to your heart rate. So 1, 2, 3, 4, 5. Okay, we're going to count for a minute. Okay, so I got 72, and that is normal for your 13, so that's a normal heart rate for you, okay? So now what I'm going to do is I'm going to do what is called an Allen test. So I need you to hold your hand above your head. Just hold it. Can you hold it kind of in a fist? And so what I'm going to do here is I'm going to let you hold it for about 20 or 30 seconds. And I'm going to occlude your ulnar and your radial pulse, and then I'm going to let that sit for a second, and then we'll let go, and you're going to tell me if you can feel the blood coming back in your hand, okay? Okay, so I'm going to occlude. I'm just going to wait about 20 seconds, okay? And I'm going to let go of the ulnar side. Can you feel the blood coming back in? Okay, good job. Okay, so now I need you to lay down for me. Okay, and I'm just going to check for any extra heartbeats. And first, because sometimes our heart can sound different laying down, I'm just going to listen to it, okay? And so again, I'm going to listen to the 4 areas. Listen to your aortic right now. And again, it sounds good. No signs of murmurs. Pulmonic. And then 2 more ribs down, and the 4th rib is going to be the tricuspid. And then the 5th mid collarbone is your mitral. And it all sounds good. So, can you turn on your left side for me? Just turn on your left. And I'm just going to listen again for extra heartbeats. See if there's any S3 or S4s. And I don't hear an S3 or S4 or any mitral reverb. Okay. So I'm going to check your pulses real quick. Can you sit up one more second for me? And then you'll be able to lay back down again. Okay, so I'm just going to check your brachial. Okay, it's just inside your arm. And it feels good. I'd say rated about an S+. No bounding, it's not weak or thready. Now I'm going to check your radial. And again, it's a good, strong pulse, not weak. Popliteal. You can see. Can you put your legs up here so they can see? So popliteal is right behind the knee. And I can feel it. And then it's the posterior tibial, which is right behind the ankle. And the dorsalis pubis. Oh, it's going back. Just put your finger over it. Okay, good job. Okay, so also I'm just going to check for edema. I don't see any signs of edema. Good perfusion. Looks good. Okay, can you lay back down for me? And I'm just going to check your abdomen this time. Okay, so I'm going to lay this over. I just going to need to raise your shirt just a little. Okay, so your abdomen is flat. I'm not seeing any signs of incisions or anything. So what I'm going to do now is I'm going to listen to your abdomen. Just going to listen to your bowel sounds, and I'm going to listen in 4 areas, okay? Your bowel sounds are normal active, not hypoactive, very active actually, but not to the point that it's hyperactive. Okay, I'm just going to check, listen to some arteries, okay? Listen for like signs of roots or breezes. Now I'm just listening to your aorta, and it sounds good, no problems there. Listening to your renal arteries. I'm going to listen on both sides also. Now listening to your iliac, which is right above your hip bone. And again, no signs of roots or breezes. And I'm going to go right below your, inside your pants, and I'm just going to listen to your groin area. And there was no problem there. Okay, so now I'm just going to do what we call percussion. I'm just going to do it on the abdomen. I'm just going to kind of lightly tap and listen. And usually most places are just going to be like flat areas, and I can usually just listen if there's any fluid. You hear the difference? So now what I'm going to do is I'm just going to palpate your abdomen. And at first I'm going to do light palpation, and then I'm going to do deeper, okay? So tell me if at any time anything's tender or anything, okay?
Okay.
Any pain?
No.
Any pain, tenderness? Okay, now I'm going to do deep. I'm just going to use 2 hands now, okay? Any pain? Okay, so now I am going to need you to hold your breath in, and I'm just going to palpate the liver, okay? Take a deep breath and hold it. Okay, so look at the margin, kind of. Pretty good. Okay. Was any of that tender? Can you hold the deep breath? Okay, so now I'm going to hold the, okay, you can let go of the deep breath, sorry. I'm going to locate the spleen. Okay, can you take a deep breath? Hold it. Is there any pain there? Okay, hold it out. Pull it out. So now I'm going to locate your kidneys, and I just want you to tell me if there's any tenderness, okay? Any pain there? Okay. So now I'm just going to palpate the lymph nodes in your groin, and I'm going to have to, I'll pull up the blanket, and I'm going to have to go in the inside of your jeans, okay? Any tenderness? And I don't feel any swelling. Was there any pain there? Okay. So now I'm going to, it's called a Murphy sign. I'm just going to need you to take a deep breath, and I'm going to curl my thumb right underneath your rib cage. And I want you to tell me when I push in if there's any pain, okay? Deep breath. Pain. Deep breath. Pain. Okay. Now I'm going to do what we call Fitz percussion. And I'm just going to hit on each side. I want you to tell me if it felt the same, okay? Felt the same? Was there any pain there?
No.
Okay. Can you sit up for me? Pull your shirt down. Okay. So now what I'm going to do is I'm just going to look at the muscles and kind of the joints, and we're going to do some range of motion, okay? Make sure, and then we're going to end with a few more of the cranial nerves, okay? Okay. Can you move your head back and front? Okay, look. Front, back, side, side. Resist against me. Push against me. Push against me. Push against me. Push against me. Okay, good job. So now what I'm going to do is I'm just going to look at your extremities. I don't see any signs of deformities, okay? Can you sit up straight for me? Can you push against my, push down? Or here, actually, pull your legs up. Okay, push against me. Push against me. Okay. Can you hold my hands? Can you squeeze my hands? Can you push against me? Can you push against me? Okay. So I'm not hearing any signs of like crepitus, any popping of the joints or anything. Now I'm going to test your and see if it had carpal tunnel. Can you follow what I'm doing? Push against it. Is there any pain? Do you feel any tingling in your hand or anything? Okay. So now I'm just going to take my hammer and I'm just going to check your reflexes, okay? Good. Behind your ankle. Good. Can you lay out flat? Okay. And now I want you to look away from me. Okay. Okay, good job. So now I'm just going to check your sensation and like your feeling in your legs, and I'm going to do some light pressure and some kind of, I say painful, but it might just feel like a little tickle. And you tell me if you can feel it, okay? Okay. And now I'm going to take my tuning fork, and I want you to tell me where you can feel the sensation, okay? So you might say my right leg, left toe, that kind of thing, okay? Okay, good job. So now what I'm going to do is I am going to I'm going to now hand you some items in your hand. Stop looking at my stuff. And I want you to tell me what it is, okay? Okay. Other hand. Okay. Okay, good job. So now I want you to lay down for me. And I'm just going to test a few more and then we'll do range of motion, okay? Okay. So what I'm going to do now is I'm going to do McMurray's sign, and I'm just going to bend your leg and you tell me if you feel any pain, okay? Any pain? Any pain? Okay, good job. So now I'm just going to check current sign, and I just want you to tell me if there's pain again. Any pain? And now I'm going to check your Brudzinski sign. And I'm just going to lift your head up and I'm going to look to see if your legs come up. If so, that would be a sign of meningeal irritation, okay? And they did not come up. Okay, so I need you to stand up. And just stand over here. Come a little closer. And so what I'm going to first do is I'm going to scoop just a little bit back. Okay. I'm going to check for scoliosis. So turn around. And first I'm just going to look at your back. And I'm going to see if any of the deformities. I'm not seeing any deformities. Can you bend over for me? I'm just going to touch your toes. Your spine is in line. You stand up for me. Okay. And as far as kyphosis, I'm not seeing a humpback. Okay, bend forward again. You bend back. Side to side. Any pain or swelling or pain or tenderness when you do that? I'm not seeing any swelling or deformities. Can you turn back around for me? And we're just going to do a few range of motion, okay? And then we will be done. Okay, so we're first going to start with our shoulder. We're just going to do, if we can do abduction, adduction, flexion, or extension, okay? And so I'm just going to show you, but we're going to focus more on you, okay? So abduction. Come back in. Adduction. Come back in. Flexion. Yeah, no flexion. Sorry, you had it. And then behind us is extension. Okay, now we're going to do your elbow. So we're going to flex, extend, come back in. Wrist, we're going to flex, then we're going to extend, come back in. Then we're going to do with your hand, we're going to do flexion, and then we're going to do extension. Yeah. Fingers, abduction, and adductions when we come back in. The knee. So we're going to do flexion, and then go behind us, we're going to do extension. Good job. Ankle, I'm going to actually come down on the feet. And then, so flexion. Flexion. And then come back down, and then go to extension. And then toes. Can you take your sock off? Okay. So toes apart is abduction. Toes in is adduction. Okay. Okay. Now we're going to do the hip. You can put your sock on in a second, Brooklyn. Yeah. Okay. So we're going to do the hip, and then so we're going to go abduction. Come back in, and now we're going to do adduction. They come back in, and then we're going to do flexion. Come back in, and extension. No, okay, good job. So now I'm going to do what we call a Romberg test. So I want you to put your feet together and close your eyes. And we're just going to stand here for about 20 or so seconds. And I'm just watching your posture. As far as so far, your coordination's been very good. And I said we'd test that more later. So just slight wobbling, which is fine. Okay, can you put your arms out in front of you and close your eyes? We're just going to stand there for a second. And then I'm going to tap them down. And they return as normally. Okay, so can you go across the room, and we're going to do a little walking. Okay, so what I need you to do, we're going to do gait walking. I want you to do heel to toe and just walk slowly across to me. Not too slow, not too fast. Okay. Look straight ahead. Okay, go back on your tippy toes. Okay, can you come back toward me on your heels? Okay, so I'm going to try, I'm going to hold your mouth. I want you to hold, oh, you can't see. Okay, good job. So one more thing. So I want you to open your mouth, try go against resistance, close against resistance. Okay, now we're gonna stand back over here, and I'm gonna just test your some more cranial nerves. Okay, so what I have is a cotton ball, and I am just gonna want you to close your eyes. Tell me if you can feel it. Okay. Okay, and now, so I have another cotton ball that's wet, and I'm gonna want you to open your eyes wide, and I'm just gonna touch the outer edge of your cornea, and I want you to tell me if you can feel it, okay? Look straight ahead.
Good.
Okay, good job. And that is it. Do you have any more questions?
I do actually. So,
No, okay.
You know how some doctors give out a lollipop?
Okay, I don't have a lollipop. No, I don't. Yeah, you can have a cookie. Okay, and we're done. Thank you.